Alright, so once it says record. Okay. You can go.
Hello, I'm Kendal Dishman, and I'm here to do a HEENT assessment on my friend and peer, Valerie. Valerie and I are here today to videotape this in the LRC. And the first thing I'm going to do is gather my equipment and supplies, provide the adequate privacy for my patient, and perform thorough hand hygiene, which is always the first key to any patient contact. So while I'm doing this, I'm noting Valerie's appearance, and I'm noting that she is dressed appropriately for the season, that there's no obvious odors, her appearance isn't disheveled, she takes care of herself, and her skin status, it's pink and normal for her ethnicity, and her posture is erect, and it is not slumped, and she is smiling at me, so she does not have a flat affect. She appears to be happy, calm, and cooperative. Valerie, how are you today?
Great. How are you, Kendal?
Good. So her mood is good. She seems to be pleasant, calm, and her speech is clear and not hoarse. And she also can hear me because she answers my questions appropriately. As far as nutritional status, Valerie, how do you feel about your nutrition?
I eat pretty good. Most of the time I try to eat something from all the food groups several times a day.
So listening to her, we might at this time perform a 24-hour meal assessment and see what she's eaten, and if need be, we can make the appropriate referrals. But at this time, it appears that her nutritional status is excellent. I also noticed that Valerie makes decent eye contact with me, and her level of consciousness, she's alert. Now let's find out if she's oriented. Valerie, what is today?
Thursday, November 5th.
Okay, and what year is it?
2015.
Okay, and it appears that she is alert and oriented to time. And where are we, Valerie?
We are at the Southwest Baptist University laboratory.
So she's also oriented to place. So I'm going to move on, and I'm going to let her know, for her comfort, that I'm going to be inspecting and palpating her face, neck, ears, everything, so that if she's not comfortable, she can let me know. But right now I'm just kind of looking and making sure that her head and hair appear symmetrical, her cranium appears symmetrical. I'm going to let her know that I'm going to touch. Now I'm going to palpate her head, and her hair appears healthy. I don't notice any bald spots or missing hair. It appears thick and healthy. So Valerie, I'm going to put my hands on your scalp, and I'm going to palpate for any kind of nodules, anything that's not supposed to be in her cranium besides her giant brain. And I don't notice any deformities at this time upon palpating. I'm also looking at her face to make sure that it's symmetrical, and it is. And while I'm doing this, I'm going to go ahead and ask her to remove her glasses for just a moment so that I may touch her temporal artery. And I'm looking to feel, or I'm inspecting to feel, to make sure that it is non-tender, okay, and that it is equal and that I feel it pulsating. I'm going to go on to her temporal mandibular joint. I'm going to ask her to open her mouth. Perfect. And I don't notice or hear any popping or anything that shouldn't be there. So we're going to move on to the eye portion of the assessment, and we're going to talk about confrontation. This is going to check more of our peripheral vision. So I'm going to ask my lovely patient if she would mind placing a piece of paper, and this is providing that my vision is also normal, and it is, over her right eye, and I'm going to put it on the same side. I'm going to move my hand, and she's going to let me know whenever she's able to see. And the same with here.
Now.
And then I'm going to ask her to move it to the other side, and I'm going to do the same thing again.
Now.
Okay. And up from the bottom.
Now.
Perfect. Okay, so what we're going to do too, while we've got these pieces of paper out, we're going to do the cover test, and I'm going to have her put it over, place the piece of paper or card over her eye, and I'm going to make sure that this eye stays fixed, and it is going to indicate that she does not have a muscle weakness. And if you don't mind doing it with the other eye, wonderful, wonderful patient. So I'm going to pick up my otoscope, and we're going to check for the corneal light reflex, that whenever I shine a light in her eye, she blinks. And again. Beautiful. Okay. I'm also inspecting the external structures and the conjunctiva and also her sclera, and I'm making sure that it's pink, that I don't notice any matting. or redness, and that her sclera is the appropriate color. Her pupils are also equal in size, but we're going to check their reaction and also their accommodation. All right, Valerie, so I'm going to shine this light in your eyes, twice on either side, and I'm checking to see if your pupils react. Okay?
Okay.
Great. And I should also see upon the second pass that this pupil also reacts. So I'm going to switch sides. Great. Okay, now Valerie, I want you to look at this otoscope, and then I want you to look at something behind me. And one more time. And her eyes also accommodate well. As far as the Snellen test, we're not going to perform one of those at this time, but if we were, we would have Valerie come to an area that was well lit. We would have a chart. We would have her stand approximately 20 feet away, cover one eye. She would start reading from the top to the bottom, from the largest font to the smallest, until she could no longer read those correctly, and that's how we would decide what her vision is. So we're going to say that, that she is positive for Perla, and we need to do one more thing. We're going to check her tracking and her cranial nerves 3, 4, and 6. And we're going to do that by doing the 6 positions, kind of like cat whiskers. So Valerie, I want you to just follow my finger, but not move your head, okay? All right, so here we go. Perfect. And we're going to do it on the opposite side now. Beautiful. And all fields tracked, which tells me that cranial nerves 3, 4, and 6 are intact. So we're going to go ahead and inspect and palpate her maxillary and maxillary and frontal sinuses. So Valerie, I'm going to put my hands on your face. And this might be a good time too, because you've been touching the otoscope and things, to go ahead and do some more hand hygiene before you put your hands on somebody else's face. So what I'm going to do is feel here. And you shouldn't have any pain or pressure, but the patient should let you know if they feel any tenderness. And above. And Valerie, does that hurt at all? Perfect. Okay, so that would be noted in her chart that I don't feel any kind of abnormalities on her face and that her sinuses are not tender to palpation. So we're moving on to the ears. And I want to take a look at her ears first, as lovely as they are. And I want to make sure that they're in the right position and they're symmetrical. And they are. And I'm going to let her know that I'm going to be pulling on both her auricle and her femur. And make sure that there's no pain with that movement. I'm going to grab my otoscope again, and I'm going to take a look in the canal. And I want to be really cautious and put my hand against her face so that I provide distance between the otoscope and myself. So in case something happens and she moves, it doesn't go jamming in her ear. And what I'm looking for here as I pull back, down and back, is I'm looking for her tympanic membrane to be pearly white and reflect that light beautifully. So here we go, Val. Great. I'm going to come to the other side and do the same thing again. Beautiful. So upon inspection, her tympanic membrane is pearly white and it reflects light well. So I'm going to go ahead and do the voice and whisper test. I'm going to have Valerie cover one of her ears as instructed. I'm going to tell her a word that's about approximately 2 syllables, and I'm going to have her repeat it back to me. And I'm going to have to whisper, which I'm not great at.
Butterfly. Hot dog.
Perfect. So Valerie heard both of those and was able to repeat those words back to me correctly. So I'm going to look at her nose now and notice that it is symmetrical and I don't see any lesions. I'm going to again wash my hands, pick up my otoscope, and I'm going to kind of pull up on her nose a little bit and look inside. I'm noting any kind of lesions, nostril patency. I'm going to make sure that her septum is not deviated and that her terminates. I don't see any polyps or anything that's not supposed to be there. This might be also a good time to ask your patient if they breathe out of one nostril better than the other. Great. And I don't notice anything that's not supposed to be there. Valerie, do you breathe out of one nostril better than the other?
No, they're both good.
Perfect. All right, so it is time to move on to the mouth and the throat. And I'm going to inspect the buccal mucosa, the teeth, the gums, the tongue, and this would also be a great time to ask your patient if they've had any kind of dental work done, if they have any partials, any dental appliances, so that you're aware, and also that's noted in the chart for liability reasons. So I'm going to look at your buccal mucosa. If you'll open up for me. So I notice that it's pink and moist. And I'm also looking at the floor of her mouth. You can raise your tongue up. Her teeth are beautiful. They're white, healthy. I don't notice any cavities. I don't see any spaces. I don't notice any missing teeth or cracked. I also notice that her gum is pink. And the roof of her mouth is also a little bit white, as it is supposed to be. Her gum line is also pink. It's not bleeding, receded, or puffy of any sort. So, I'm also going to look at the palate and the uvula, so I'm going to ask her to say "ah" again, but prior to that I'm going to put on some gloves, because you don't want to stick your finger in anyone's mouth without gloves on, for their protection and your own. Alright, so what I'm going to do is take a look at the palate, and again, I think I noted that it was whitish in color, but still pink, and it is normal. And then the uvula, whenever she says "ah," we have great mobility, meaning that it is midline, it is mobile, so it tells me that her gag reflex is intact, which also indicates that cranial nerves 9 and 10 are intact as well. And Valerie, I noticed that you don't have any tonsils, so that would need to be noted on her surgical history as well. So do you mind to stick out your tongue for me? Great. And that will also tell me that cranial nerve number 12 is intact. So as I look at her, I'm looking at her neck as well, and I'm noticing it is symmetrical. I don't see any masses. And I'm going to let her know that I'm going to put my hands on her again. And I'm going to check for any pulsations, masses, and I'm also looking for any jugular vein distension, and I don't see any. So we're going to move on to the lymph nodes, and we're going to palpate, and there's several areas. All these lymph nodes should be pea-sized, they should be mobile, and they should be soft, and they shouldn't cause her any pain. They should be non-tender. So as we move through, I'll note those, and at the end I'll let you know if they were non-tender or not. So we're going to start with the pre-auricular. We're going to move on to the post-auricular, the tonsillar, the submandibular, the submental, the anterior cervical, the posterior cervical. The deep cervical we'll do in just a moment, but we're going to go ahead and go to the supraclavicular, which is right here, the infraclavicular, and then the occipital. And for the deep cervical, oftentimes you can't palpate these or feel these, but I'm going to go ahead and have her turn her neck, and I'm going to try to feel here. And I don't feel that on this side. Let's try again. And not there as well, but that's not anything that would be unusual or not normal. Valerie, did you have any tenderness palpating any of your lymph nodes today?
No, I didn't.
Perfect. Okay, so I'm also going to palpate her carotid pulse, which is here. You want to be really careful that you don't press hard, cause any kind of dizziness or syncopal episode. And I feel it, and I also feel that her trachea is midline. And I'm going to go ahead and have her kind of turn her shoulders. We're going to check for a thyroid mass or a goiter. So this might be a good time, too, nutritionally, to find out if she's getting plenty of iodine in her diet as well. So you want to go ahead and swallow for me? Beautiful. And Valerie, do you have any issues swallowing? Do you feel anything in your throat when you swallow?
No.
Okay, so upon palpation and also asking her, assessing her, she doesn't feel that she has any kind of mass in her throat. So let's talk about range of motion. I would like for you to take your chin and touch your shoulder, and again to this side. Wonderful. And then here to your chin. So I see that Valerie has excellent range of motion, so I'm going to check her muscular strength. Valerie, I want you to push up against my hands. Beautiful. Okay, and I want you to try to move your face that way. Okay, and again this way. Beautiful. So her muscular strength, she's strong and equal on her shoulders and on her face. She has great muscular strength and great range of motion. This concludes my HEENT assessment video. Thank you, and have a good day.